Dissociative identity disorder caused by the mental health profession? This question I'm going to answer today. So great question. This is one of the things that we hear so much, that DID is caused by psychologists or mental health professionals. So I'm going to begin this response by first saying that this is a really touchy subject, because what we're going to be doing here is potentially stigmatizing mental health. So throughout the history of our journey with mental health, whenever people don't understand what is going on with someone's condition, then they are suspected as maybe it being made up. Maybe your depression, you're not really depressed. Maybe you're not really anxious. Are you overreacting? You're being too dramatic. Why are you so sensitive to this? You're not sick. It's in your head. Okay, so how many of us have heard those things? If you can't see it, if you can't see my leg is broken or that I've got a condition, then we become suspicious. And what we end up doing is putting it into the context of our belief system, of our worldviews. And so, like I say, worldviews are sand in a picnic. They get into everything. So the origin of this concept that it was a provider-made, a therapist-made condition, I believe, from what I remember, and if you know otherwise, please let me know, that this came out of a movement in the 1980s and 90s, where there was this big movement about false repressed memories. And there was books coming out saying, if you have headaches, if you have stomach problems, if you're anxious or you're depressed, if you have relationship conflicts, then you have repressed memories. So people started digging. They started looking, saying, do I have this? And therapists started to believe that people did have false repressed memories that needed to be recovered and looked at for them to heal and overcome these struggles. However, a lot of the things that they said that we were struggling with were universal truths. It's part of the Barnum and Bailey effect, that there are universal truths that we all identify with. We all have moments that we have conflict with other people, where we're worried, we're stressed, we're sad. So what happened is that everybody was identifying with this and becoming really alarmed. Well, there was some research that came out of the University of Washington by Lovis. I believe it was Lovis. Might be getting that wrong, but yeah. I'll have to try to find that and get that to you. But I remember reviewing this when I was in college. And what they did is they took these kids that were reporting this abuse situation and they were investigating it. And what they found was that the police officer who was investigating the situation and asking the father questions, interrogating the father, tried to entrap the father by making a suggestion to see if he would confess, and said, can't you remember this? Can't you remember that? So the father went home, and the officer knew that what he was saying, what he was communicating that was true to this person, was indeed not true. And the father came back the next day with a full written confessional letter of the story of this untruth that the officer said. And that sparked for them to do further research into, what is this thing? How could this man go home and remember and recall all this information without it being true? And so one of the studies they did is they went around, they asked people, do you remember when you were little and you were at Disneyland and you saw Bugs Bunny? Well, all these people raised their hand. And in fact, when I teach at colleges, this is something I would do in my Psych 101 class. I would ask this question. Well, recently they have funny tunes and stuff like that, so it doesn't quite work anymore. But back in the day, there was no Bugs Bunny at Disneyland. But everybody was remembering Bugs Bunny at Disneyland. They could remember meeting Bugs Bunny and taking pictures of Bugs Bunny, but there was no Bugs Bunny in Disney. So we started to find that our memories can be problematic, and they can be suggested into people. Well, based on this research, this led to the movement and the training and now the policy around interviewing children victims of abuse. If a child is being removed from a home because of sexual abuse or physical abuse, There is a designated professional who's trained in the specific method of questioning to ask the child information. The reason why they use this is so that the confession of the child cannot be polluted or questioned by someone saying it was suggested. So we have been trained very specifically on how to approach information and inquire about information in a way that doesn't lead to suggestion or the possibility of creating memories. So this question, is this created by mental health providers? Well, we can say a lot of disorders are created by mental health providers. We didn't have these diagnoses before. At some point, someone had to name them, someone had to describe them, and communicate what these disorders were. And that is what research is all about. We research populations, we gather the information, we use scientific methods that has been shown to be reliable and valid, not pseudoscience, but actual empirical research. And based on that information, we get facts and truths about certain groups. And then we can say, this group of people who report these symptoms and have these experiences fit into this description. And we're going to name it this diagnosis. And so there's parameters around it. There's specific criteria that someone must meet in order to be given that diagnosis. There's a duration criteria. They have to have the symptoms for 4 weeks or 2 months or so many days. There is descriptions like let's say for depression, you have to have concentration problems, sleep disturbance, loss in appetite, loss of interest. There could potentially be 9 descriptions, and they say you have to meet 7 out of these 9 or something like this. So a lot of times people are given a diagnosis, but they don't fit the diagnostic criteria. I see this a lot in my work with individuals who've been diagnosed with borderline personality disorder. They might cut, they might have problems with anger. So they might meet 2 or 3 of the criteria. Don't like abandonment, be angry, impulsive, but they don't meet all the rest of the criteria. So technically, they cannot be given that diagnosis. And yet we're getting sloppy out there. People aren't doing due diligence and they're being reactive to a stereotypical symptom. Like if somebody has been a cutter, then they must be borderline. And so then they're given that. Or if they're angry at the doctor and cause some problems in the office, then they must be borderline and they're given that. We have been trained as professionals on a way to approach information, how to evaluate, how to investigate, and to know the diagnostic criteria for all the different mental health conditions. If we are not competent in that area, then we are directed not to work in that area. So the delivery of that care needs to be done competently and ethically and legally by a licensed medical practitioner. And folks, they make mistakes. They do make mistakes. So we get second opinions, third opinions. If you have been given a diagnosis, doesn't feel right, you need to see somebody else and see what they think about it. Rule out some medical reasons why you might have that diagnosis. So the intention of the diagnosis is to inform us on what is the best practice for treatment. So what is the best medication to give? What is the best therapy to give? This is the purpose of it, not to define the person or define what's possible for you or your future. It's meant for us to know what to do to help you and what kind of outcomes we can expect with certain types of treatment. It also informs us what kind of treatment would cause a bigger problem for you. Like this medication with this disorder may make you sick, and this treatment may worsen your symptoms. So it's there for us to direct your care. Unfortunately, it has not been used that way in all circumstances. So if somebody comes to us for care, we need to use our professional training and be current with the current literature, Be aware of what the newest and latest research is because it's constantly changing. Like, for example, trauma work. We used to think that our physical responses started with our head and then it made our body feel what it feels. Well, now we've learned otherwise. We have bottom-up theory, which means your body will have a response and a sensation, which will then tell your mind what to feel. So we need to stay current and see what is evolving, how we're progressing as a profession. So if a provider suspects that someone might actually have dissociative identity disorder, it's really important that they are competent in that area, that they know how to evaluate it, and that that individual meets the diagnostic criteria. It would not be acceptable for someone to come in and for them to start suggesting that there are alters. You don't suggest that there's alters. You identify something you're seeing or something that they're telling you, and then you say, based on what you're telling me, it fits this description. But we have to be very careful about what we say to individuals. Some people are sad for a life event. Doesn't mean that they're experiencing major depression. You could be grieving. That doesn't mean that you meet the criteria for major depression. So again, you have time, you have symptoms, and then it also has to cause significant problems in your daily living, your relationships, your health, your finances, work, things like that. So when it meets all of those components and they fit the diagnostic criteria, then we can begin to educate somebody about their diagnosis. So there are people that have had the experience of seeing a provider, being sad, being conflicted, and the provider will say things to them. I think you have this. And they're really not first saying, I have some questions for you. Let's go through these questions. Okay, so there's a difference between I need to gather this information so that I can have an informed decision versus I think this is happening for you without doing their due diligence. It would not be okay to suggest to someone a disorder that maybe that person's not bringing to you and without doing that evaluation in the first place. So in general, a lot of mental health diagnosis may be suggested to someone but may not be what that person is bringing into the therapy room. I had this experience myself when I was 18. I had a therapist say to me, I think you were sexually abused. Do you remember anything like that? And I thought, and I'm like, I really don't recall anything like that from my childhood. And they go, but you do. You have all of the signs, you have all of the symptoms. I just know it. And session after session, this person drilled me, just think about it, just go deeper, and I honestly couldn't think of anything. And it got to the point where he encouraged me to confront a family member and ask them, did you do this to me? I felt so bad, my poor cousin. I approached him and I told him, and he was so compassionate. And he said, oh no, Shawn. And really there was nothing. Now, the therapist told me if he's angry and defensive, then he's obviously guilty. That's not always true either. Recently, I had an event where I thought a family member took medication from my house, and I approached him and that he was angry and defensive. And I, because I was told that once in a day, thought, oh, he's definitely guilty. However, a few months later, I found what I thought had been stolen in a place that wouldn't have been hidden by anybody. And it was very obvious that this person was not guilty of what I had thought they were guilty with. So we have to be really careful about our assumptions we make and to believe something to be true without the known facts. So if you are working with a provider and the provider is suggesting things and it doesn't feel right for you, you need to maybe see another provider and get another opinion. It's important that you feel safe with that provider and that you are supported and that that provider is behaving ethically, competently, and within their scope of practice, within their training. It's also very important that we as people do not determine what somebody else's internal experience is. How do we know? We're not in their shoes. And if you haven't had this experience, then how could we possibly tell someone what their reality is like? It's like telling someone they're colorblind. You're not colorblind. I've never been colorblind, so it's impossible for you to be colorblind. Really? I don't have DID. I'm a singleton. I cannot wrap my mind around that experience, but I am not going to presume to tell these people what they feel and think and hear and experience inside their body and their brain. I'm not. But I am going to gather research and evidence and find that, wow, this is really interesting. We have this collective of people all over the world who have this history in common, these symptoms in common, this way of living life in common. And based on research, we can conclude this outcome. So is it possible that DID is suggested by a provider? It is as much possible as it is for a provider to suggest any other diagnosis, including physical diagnosis, dental diagnosis, or anything of the sort. Is it possible that a therapist could suggest a memory into a person? Yes, unfortunately it is. We know this from research. This is why it's so important that you make sure you see a competent provider who is licensed and current and practicing within their scope of training. So those are my thoughts on it today. If you had this experience where you saw somebody and they suggested something and it just made your situation worse and you were really struggling, know that you can have a different experience. There are providers out there who are safe, who will support you, who will work with you, and who will not violate your boundaries or try to control your mind or your behavior. This is so sad when this happens. It absolutely breaks my heart. And unfortunately, there is abuse by therapists. We recently heard of a case in Oregon where a child psychiatrist was abusing the children that he was seeing. So just because they're licensed and a trusted citizen does not mean that they are safe, right? Think of all the priests and all the people in authority that have broken the safety boundaries. So if you are uncomfortable, if it went south, if you had a previous therapist that traumatized you, there are safe providers out there that will help you to work through that and can understand the impact of that and really try to create trust and safety with you to help you heal from that experience. I hope this is helpful, and I would love to hear your thoughts on this. Thank you so much for your comments. This has just been absolutely rewarding to have this dialogue with you and to be part of this conversation. So until next time, I'm Dr. Shawn Horn, a licensed psychologist. Bye. Hi, my friends. Thanks again so much for joining me today. I can't wait to bring you more content in the future. So please make sure you subscribe, like, follow, comment, and let me know if there's anything else you want me to talk about. Also, come on over to Instagram and join me over there. But whatever you do, make sure you come over to my website and sign up on my email list so you can get the newest and latest updates about some cool stuff I have coming ahead. So thanks again and have a fantastic day. And remember, you are amazing.